For this next session, we are going to focus on laboratory identified events or LabID events for long-term care facilities. As a reminder, you may use your clickers on your tables. We're going to have several case studies in this session. So either log on to responseware.com using any web browser to join. If you've already logged on to responseware.com, then you are good to go. If you close that browser, you can just open another browser and type in responseware.com with your session ID as NHSN. For those of you in the room, you can either use your clicker or your smartphones. For this session, we are going to talk about and have an understanding of the LabID event surveillance and reporting for NHSN, explain the Clostridium difficile infection, or C. diff, or CDI, however you want to pronounce it, and the multi-drug resistant organisms, MDRO, LabID event definitions and accompanying protocols. We're going to talk about how to enter LabID events into the NHSN application, as well as specifically hone in on the monthly reporting requirements for CDI and MDRO LabID event reporting, and then talk about the importance of and the steps for resolving data quality. So, as you can see from our objectives, some of this is a repeat from the earlier session. So like I said earlier, by the time you guys leave on Wednesday, you're going to know this stuff in your sleep. Again, the long-term care facility component, this is the umbrella as the component, and then we have the three modules, reporting modules under that component, the HAI for urinary tract infections, which we're going to talk about tomorrow, the LabID for MDROs and C. difficile, which we're going to talk about now, and then the prevention process measures module for hand hygiene and gown and glove use, which you guys are going to talk about tomorrow. CDI and MDRO LabID event reporting is available to certified nursing facilities, nursing homes, as well as intermediate chronic care facilities for the developmentally disabled, which I think that covers your facilities. Want to start with giving you a high-level definition of LabID event reporting and kind of talking a little bit about why it's important. For LabID event reporting, you're going to use a set of standardized case definitions that incorporate a combination of laboratory-based metrics as well as limited admission, discharge, and transfer data, or ADT data. And this is going to be used as a proxy measure for surveillance of infection events for C. diff as well as MDROs. This module is quite different from the HAI module for UTI event reporting. So you're going to see the differences between today and tomorrow, because this module allows you to, guesstimate the burden of infection or organisms that you have in your facility, and you're not necessarily calling these organisms healthcare associated. They may be or they may not be, but it's really allowing you to understand that burden that's coming into your facility and residing in your facility. There are many benefits to LabID event reporting. It took me a little while as an IP coming into the CDC and learning about LabID event reporting. It was challenging for me to grasp this thing called LabID event reporting, because as an IP, we're used to HAIs and the healthcare associated things. And so with LabID being different, it's a little bit challenging to understand. But once you really understand it and you understand the benefits that it can do for you as far as the time commitment and the benefits it can do for just understanding the burden in your facility, I think that you will appreciate this module like I have come to appreciate. So it allows you to track these infections events without clinically evaluating your residents. And what that means is that the time commitment for surveillance is less laborious, because you're not having to spend as much time digging in the resident charts. Minimal chart review. That's a big benefit of LabID event reporting. And it's also objective laboratory metrics. So it's allowing you to objectively look at a resident to determine if that resident has what we call a LabID event. And again, you can use those estimates to assess the infection burden in your facility, to estimate the exposure burden among residents as well as healthcare workers in your facility, to assess the need for and effectiveness of your prevention efforts in your facilities around prevention of MDROs and C. difficile. And it also allows you to compare your facility rates to those facilities that are similar to your facility. I think it's really important that we're using objective definitions because as we've learned this past couple of years, long-term care facilities differ, and they differ on the amount of resources that you have available in your facility. You may differ on things such as chart review, how thorough your documentation is, which impacts validation in your facilities. The resources are different. So with LabID event reporting, because the definitions are objective, everyone's comparing apples to apples and oranges to oranges when they're applying the protocols and definitions. If you've looked at this module, then you'll know there are several reporting options available. Of course, we have the C. difficile infection, or CDI. We also have the multi-drug resistant organism, MDRO. Within that module, facilities can choose to monitor one or more of the following organisms: Staphylococcus aureus, methicillin resistant, so your MRSAs; Staphylococcus aureus, methicillin susceptible, your MSSA with MRSA surveillance; vancomycin resistant enterococcus species, or VRE; then your cephalosporin resistant Klebsiella species. And then we also have the carbapenem resistant Enterobacteriaceae, or your CRE. And for that, facilities will include the Klebsiella species, the E. coli, and the Enterobacter under CRE. And then we have Acinetobacter species. So residents who are included in LabID event reporting for one or more of these options are all residents in your facility. And we consider that, or call that, facility-wide inpatient, or FAC-wide in. And all that means is that when you agree to perform surveillance using NHSN protocols, that you're agreeing to include all residents receiving care in your facility, and you're including those residents in your surveillance. It includes residents with non-duplicate specimens that are collected while the resident is being cared for in your facility, and I will go into depth with that. Residents with non-duplicate specimens collected during a brief outpatient visit to an emergency department or a clinic or physician's office are included in LabID event reporting for your facility only if that resident returns back to your long-term care facility on the calendar day of transfer to the outpatient facility or the very next calendar day. So within 2 calendar days, if that resident returns, then any specimens collected from that resident during that brief outpatient visit are to be included in your LabID event reporting for your facility. You will notice that when reporting that LabID event, the current admission date does not change, and that should be key to knowing that that specimen is included. And I see some eyes crossing, and we will go into specifics about this as I get further into the presentation. There are some residents that should be excluded from LabID event reporting, and those are residents who have left your facility and were admitted into another healthcare facility. Any specimens collected while your resident is receiving inpatient care in another facility are excluded from LabID event reporting for your long-term care facility. Now, they will be included in reporting for that other healthcare facility, but as far as your reporting goes, what happens outside of your facility during another admission is excluded from your reporting requirements. Residents with duplicate lab results, and this again includes specimens that are collected during separate admissions. So let's say that you have a resident who has a positive C. difficile on day 1. The resident gets discharged home on day 3. for some reason the resident is readmitted back to your facility on day 10 and has another positive specimen, that's considered a duplicate because it hasn't met that 14-day requirement that we're going to talk about. So the 14-day duplicate requirement is across admissions to your facility. And then any resident who has a positive lab result before admission to your facility is excluded from your reporting. Here is our website and the specific area for printing the protocol, looking at training materials, data collection forms, and etc. What we're going to do now is we're going to begin with C. diff reporting, and then we're going to go into MDRO reporting. Anybody thirsty? So Dr. Stone was talking a little bit about prevention and why prevention is important. And so this slide kind of goes along with what she was saying to you guys is but when you're looking at prevention, one of the first things that you want to do is really first understand what's the risk in your facility. So here are some questions that we came up with that may be important for you to consider when considering a surveillance program for your facility. How do we define C. difficile? If you don't participate in NHSN, how do you define which residents get reported or included in your plan for C. difficile? How do you define a duplicate specimen? How do you track and measure C. difficile in your facility? Because if you're not tracking and measuring, how do you know what your risks are? You may know a resident here and a resident there, but how do you really know down to a unit level what the risks are in your facility? Do you know if your rates are high? Are they high? Are they low? Are they comparable to your neighboring long-term care facility or to your acute care facility? And if your rates are high, why? Are they high because you have a skilled nursing facility? Are they high because you receive a lot of admissions from the local hospital? Are the rates high in your community? When you're coming up with your surveillance plan, these are just some examples of considerations that you want to keep in mind when determining if you should include C. difficile LabID event reporting in your surveillance plan for your facility. We're going to begin with our first knowledge check. And the polling is open. How is C. difficile infection surveillance performed in participating NHSN facilities? A, the facility uses CDC's National Healthcare Safety Network LabID Event metrics to identify and report residents with C. difficile in all resident care locations in the facility. B, the facility uses CDC's HAI module to identify and report residents with C. difficile in all resident care locations. Or C, the facility uses CDC's NHSN LabID Event metrics to identify and report residents with C. diff in the skilled nursing locations in the facility. So make your selections now. And just a reminder, if you're web streaming, you are also able to participate in these polling questions. And I have the URL at the bottom of this slide, responseware.com. Okay, looks like the responses are slowing down. Okay, very good. So 69% of you who participated are correct. For CDI surveillance using NHSN, you will use NHSN LabID Event metrics to report C. difficile among all residents within your facility, all resident care locations, so fact-wide in. Some things to keep in mind. Again, fact-wide in surveillance is required, and I say this because facilities sometimes they'll send us a question and they'll want to look at their C. diff just in their skilled nursing. And you can monitor and run analysis report using NHSN just of your skilled nursing facility. You're able to run reports at that resident level, that location level. But for reporting, you must agree to reporting all C. difficile within your facility. And then what that does is it gives you the option to run facility-wide analysis reports to look at the burden in your entire facility, and then you can break it down and look at specific resident care locations. You must perform your testing on unformed stools only, and the stools should conform to the shape of the container, just like that picture that I had on the front page. If your facility has, or all facilities really should have a policy in place that you will only test unformed stools. If you have a laboratory in your facility, for those of you who send your specimens to an outside facility, you may want to follow up and make sure they have that same policy, because you want to make sure that you're testing the correct specimens so that you're not getting a lot of colonization. And again, lab results obtained before a resident's admission to your facility or during an admission to another facility are excluded from fact-wide and reporting. And then a non-duplicate lab result collected from an emergency department or other outpatient setting must be included in your reporting if that resident returns to your facility on the same calendar day or the next calendar day of transfer. There are some common terms and definitions that are in our protocol that I want to go over with you. And the first one is C. difficile positive laboratory assay. And this is defined by NHSN as an unformed stool that tests positive for C. difficile toxin A and or toxin B. And this does include your molecular assays such as PCR, or a toxin-producing C. difficile organism detected by culture or other laboratory means. And the culture, as we talked about in the earlier session, will be less common. So this is how you identify or define C. difficile positive laboratory assay for NHSN reporting. A CDI Lab ID event is defined as a non-duplicate C. difficile positive laboratory assay. And then a duplicate C. difficile positive laboratory assay is defined as any C. difficile toxin positive lab collected from the same resident following a previous C. difficile positive laboratory assay within the past 14 days. And we're going to have some exercises to help you grasp this definition. So basically, once you collect a positive specimen from a resident, you should not report any more positive C. diff specimens from that resident within 14 calendar days. Specimens that should be submitted to NHSN as a C. difficile Lab ID event. And again, I know I feel like I sound like a broken record, but we receive so many questions about this, and I just am trying to give it to you guys in different ways so that you truly understand how to report these positive specimens. So I'm not going to read this actually, because this is a complete duplicate slide, but it's in there for you guys who are visual learners to keep reading it. But, or do you guys want me to read it? You want me to keep going? Okay. This is the thing my teenager complains about. Okay. Again, this is another duplicate, but again, I'm talking about specimens that should not be reported. I'm not going to read this to you again, but you have this. Okay, so what if the resident has a known history of C. difficile? We do get this question a lot. A resident comes into your facility and you know this resident has tested positive for C. difficile in the past. Do you report it or do you not report it? So any non-duplicate positive C. difficile lab assay collected from a resident must be reported even if that resident has a known history of C. difficile. And this is important because even though your facility may have great resources and surveillance resources at your fingertips, not every facility has those resources. So it's really important, even if you know the resident has a history, to report it if that resident meets the requirements in your facility. For you visual learners in here, I included a figure for you. I actually have this printed and at my desk. I just find it easier when I'm looking at this algorithm rather than reading a bunch of text on a piece of paper. And so I would recommend that you print this if you're a visual learner. Okay, let's check your knowledge again. Mr. J, a resident in your long-term care facility, was readmitted to your facility after receiving brief inpatient care at a local acute care hospital. You read in his chart that during his admission in the acute care facility, a loose stool specimen tested positive for C. difficile. Should you report the positive C. difficile test result that was collected during his admission in the acute care facility? Yes or no? Your answer to this is going to determine if I really do need to go back and read those slides to you. And again, web streamers, we encourage you to participate as well. Okay, very good. So the answer is no. You will not report the test that was collected during an admission in another healthcare facility. Good job. Okay, let's try another one. What if Mr. J had another loose stool specimen collected within 2 weeks of being readmitted to your facility and it was positive for C. difficile? Should you report this specimen as CDI LabID event? So we know that he had a positive during his inpatient stay, and now, less than 2 weeks later, our facility tests tell him he's positive. So should we report that? Yes or no? Okay. Ooh, this is a tie. Ooh, maybe I do need to go back and read the slides. The answer is yes. So think of C. diff reporting as the same. What happens in that acute care facility stays in that acute care facility if it was an admission, okay? So anything they do, I mean, of course you care about what they do to your resident, but any specimens or labs that they collect there does not impact what you're going to report in your facility. So yes, you would report that specimen. And which is another reason to make sure that your clinicians, your prescribing and your ordering clinicians in your facility have read the recommended guidelines for testing, so that they're not retesting and getting possible colonization or continued infection. Okay, another knowledge check. Ms. T, a resident in your long-term care facility, was transferred to the local emergency department on June 1st for complaints of ongoing diarrhea and fever. A loose stool specimen collected in the emergency department tested positive for C. difficile. After receiving IV fluids, Ms. T was transferred back to your long-term care facility on June 2nd, so 1 day later, and was put on contact isolation. Should you report the positive C. difficile test result from the emergency department as a C. difficile LabID event for your facility? So this is a specimen that was collected in that emergency department, and your resident was transferred back to you. What do you do? Okay, let's see what we have. Okay, Most of you did get that correct. The answer is yes. Since the specimen was collected in a temporary outpatient location and your resident returned right back to you, then yes, you would include that in your LabID event testing. Good job. With that, I have a tip for you. We do encourage you to keep a positive or line listing of all of your specimens. And that way it's easy for you to determine what's a duplicate and what is not a duplicate. And I'm going to, when we get to some of these other case studies, you will definitely understand why. I want to talk briefly about analysis of the CDI LabID events, because I think this will kind of help you put it together of why it's important to report all non-duplicate specimens. You will get some more of this during the hands-on lab sessions. Elizabeth is going to talk about some of this categorization of the LabID events, but NHSN, the data that you put into the application will be analyzed, and the CDI LabID events will be categorized to determine if the LabID event is what we call community onset, or CO, versus long-term care facility onset, or LO. Any LabID event that is categorized by the application as long-term care facility onset will then be further classified as, is it acute care transfer long-term care facility onset? That's a mouthful. Or ACTLO. The application will also determine if that CDI LabID event is an incident or a recurrent case. A community onset, or CO, is defined by NHSN as the specimen is collected 3 calendar days or less after the current admission to your facility. So if that specimen is collected on day 1, day 2, or day 3 of the current admission to your facility, so the most recent admission to your facility, NHSN will categorize that specimen as a community onset case. If the specimen is collected more than 3 days after that current admission date to your facility, NHSN will categorize that specimen as long-term care facility onset. And then the application will further classify the long-term care facility onset based on previous transfer of that resident from an acute care facility. If the resident has transferred from an acute care facility in the previous 4 weeks, the application will further classify it as an ACTLO, acute care transfer, long-term care facility onset. In my screenshot, I wanted to point out the questions that populate this analysis. The date of current admission, which we're going to talk about, the date of specimen collection, and then the question here asking if the resident has been transferred from an acute care facility, and if so, the date of last transfer. So that's why these 4 questions, it's very important that they're answered correctly so that your categorizations and analyses are correct. NHSN will then further categorize your CDI LabID events based on the date that specimen is collected and any prior specimen collection date of the most recent CDI LabID event entered into the application. An incident CDI LabID event case is defined as the first C. difficile LabID event ever submitted for the resident. So either the resident is new or this is just the first CDI event that the resident has had and you've entered into NHSN. That will be considered an incident case. Or if it has been more than 8 weeks since the most recent CDI LabID event entered into the application for that resident. A recurrent CDI LabID event is any CDI LabID event entered 8 weeks or less after the most recent CDI LabID event for that resident in your facility. So again, these categorizations are based on specimen collection and reporting in your facility only. And the example I have here is a screenshot of one of the analysis reports, a line list that you can populate out of the NHSN application. And I like this line list because you can customize the line list like I have here, and you can look at your resident level LabID events, and you can look at the date of the event. You can look at the location of the resident at the time that event occurred. You have the ability to determine if this resident recently transferred to your facility from an acute care facility, and it just allows you to get other data. So was the resident on antibiotic therapy at the time of transfer? Because that may be an indication of burden coming into your facility. You can also include the CDI assay, was it incident versus recurrent, as well as the categorization in your line list. So if you have an administrator come to you and want to know what is the burden of C. difficile in our facility, this is a great report that you can run and show your administrator. And Elizabeth will be showing you all during her lab session today and tomorrow how to run this report. And again, another visual to help you understand community onset versus long-term care facility onset. If the resident is admitted on March 1st, then any positive specimen March 1st, March 2nd, and March 3rd will be categorized as community onset, and then anything on day 4 or after goes to long-term care facility onset. It is important that facilities report all non-duplicate CDI LabID events, even if they're community onset. We have facilities that will sometimes think that they don't have to report the community onset cases, but it's very important that you report all of the non-duplicate cases so that prevalence can be determined for your facility. Here is another knowledge check. This is not on the clickers or responseware, so we're just going to kind of do an interactive in the classroom, and I apologize to the web streamers, but please continue to follow along. So assume that all of these are the C. difficile test results for a resident who is recently transferred from an acute care facility to your facility. The resident has a current admission date of February 1st, 2018. We have a specimen collected on February 3rd. So this is the first specimen collected for this resident. Is this considered a duplicate specimen? You guys can just yell out loud. Okay, good. Should this specimen be submitted to NHSN as a CDI LabID event? Yes. How will NHSN categorize this CDI LabID event? Very good. Community onset because the current admission date is less than 4 days. The same resident has another specimen collected on February 11th. Is this a duplicate? Yes. Should we submit this to NHSM? Okay. Oh, I'll give you the answer. Oh. The resident has another specimen collected on February 19th. Is this a duplicate? Yes. This is a trick question. So I wanted to show you this because this is why it's important to keep a line list, because even though it has not been 14 days after the 211, it has been 14 days after the 2/3, right? So it's really important just to know if this is a duplicate. So this is a duplicate because we had a positive on 211. So even though we did not report the specimen on 211 to NHSN, you have to keep up with that line list to know that it's a duplicate, because if you enter this, NHSN only knows the specimen that was collected on February 3rd, right? NHSN does not know about the specimen that was collected on February 11th because it wasn't entered, because it was a duplicate. So this is just to demonstrate the importance of keeping up with your line list to know what's considered duplicate and what is not. So we would not submit the duplicate to NHSM. Another specimen is collected on February 29th. Is this a duplicate? Very good. So the resident had a previous positive, it's at 9 days beforehand. And should you submit this to NHSN? No. And then the resident has another specimen collected on March 19th. Is this a duplicate? And should you report this? And how will this be categorized by NHSN? Long-term care facility onset. And it is not considered acute care transfer because it's been more than 4 weeks since the last transfer. Okay, good job. Okay. Now I want to move on to the multi-drug resistant organisms and talk a little bit about LabID event reporting for those guys. So the same with understanding the burden and exposure of C. difficile in your facility. When you're considering your surveillance plan for the year, you want to think about, should I report MDROs? And if so, which ones do I report? Because we're understaffed and we can't report all of the MDROs. We just don't have enough staff. So ask yourself these questions, and maybe this will help you come up with your surveillance plan. Do we know what MDROs we have in our facility? Is it MRSA? Is it VRE, ESBL, CREs? How do we currently track and measure those MDROs in our facility? Are the rates high? And if they're high, why? Another really important question is understanding the burden in your community, because the burden in your community may just become your burden, because you may, especially if you have skilled nursing facility, you're going to get these residents in your facility from the acute care facility, and they're going to potentially be bringing burden into your facility. So it's really important just to know what's going on in and around your facility. And then again, Namali touched on some prevention, understanding which residents are potentially most affected by MDROs, skilled nursing versus your long stay, recently hospitalized, those residents with indwelling devices, and those residents with wounds. I read this list to you earlier, so I'm not going to read it again, but it's here for you. These are the options for NHSN MDRO surveillance. Here are the NHSN definitions. Even if we probably have some lab folks in here who may have different definitions from your training of what is considered certain MDROs, but for NHSN reporting, it's really important that you're following the NHSN definition for each of these organisms so that, again, when you're comparing your data to your sister facility, that you're comparing apples to apples. So for MRSA, you're looking for your Staph aureus testing resistant to oxacillin, methicillin, or cefoxitin by standard susceptibility testing methods, or by a positive result from an FDA-approved test for direct MRSA detection from that specimen source. For MSSA, you're looking for Staph aureus testing intermediate or susceptible to oxacillin, methicillin, and cefoxitin by standard susceptibility testing methods. Just as a note, if you would like to perform surveillance for MSSA, you must also be performing surveillance for MRSA. You have to do those together to be able to perform MSSA surveillance. You cannot do MSSA by itself. We do get questions of why do you have MSSA as a surveillance option? And the reason that we do is because some facilities like to look at their MSSA labs to look at the percentage of those that are MRSA positive. And that's why we keep it as an option for our users. Then you have VRE as an option, and this is any enterococcus species that is resistant to vancomycin by standard susceptibility testing methods or by a positive result from an FDA-approved test for VRE detection from that specimen source. Ceph-resistant Klebsiella is a Klebsiella species testing resistant or intermediate to cephalosporin antibiotics like ceftazidime, cefotoxamine, ceftriaxone, and cefepime. And I know I butchered some of those names, so I apologize. Then you have CRE, which is E. coli, basically Klebsiella species and Enterobacter species, testing resistant to imipenem, meropenem, doripenem, or ertapenem by standard susceptibility testing methods, or by production of a carbapenemase demonstrated using a recognized test such as PCR or other test. As a note, if your facility chooses to participate in CRE surveillance, then your facility must include all 3 of these organisms in your surveillance. So you cannot just conduct CRE E. coli surveillance for NHSN. You must do CRE E. coli, Klebsiella, and Enterobacter species when participating in that particular option. And then you have your Acinetobacter, which is any Acinetobacter species testing resistant or intermediate to at least 1 agent and at least 3 antimicrobial classes. So if these following 6 antimicrobial classes, you would need at least 3 of these here. When performing surveillance for multi-drug resistant organisms, you must include all specimen sources for surveillance. Some common terms and definitions. An MDRO positive isolate is identified as any specimen obtained for clinical decision making testing positive for that MDRO. This does exclude tests related to surveillance testing, such as your nasal cultures or rectal cultures for surveillance testing. An MDRO lab ID event is defined as an MDRO positive isolate tested on any laboratory specimen source when the resident has no prior positive of that same organism from any specimen source collected in the same calendar month, except when a unique blood source is identified. If you don't already see where we're going with this, I'm going to go ahead and tell you. This surveillance is a little bit different than surveillance for C. difficile. It takes a little bit of getting used to, but I think that when we get to the figure, I think that's going to help you. A unique blood source lab ID event is defined as an MDRO isolate identified in a resident with no prior positive blood culture for the same MDRO in the past 2 weeks. So this definition is the same. It matches the CDI lab ID event, as you're going to see. Okay. You guys ready for this? When participating in the MDRO lab ID event, a specimen is considered a lab ID event when the specimen was collected from the resident while receiving care in your facility or during a brief outpatient visit when the resident returns on the same day. So that part is the same as the C. difficile lab ID event reporting. Okay, now we're going to talk about, I'm getting down to where it's going to differ a little bit. Additionally, that specimen is the first positive MDRO collected from any specimen source for the resident during a calendar month, or if it is not the first positive, it is a positive MDRO collected from a blood source, and that's what we call the unique blood source. If that's the case, it's the first positive MDRO from any specimen source for the resident during the calendar month, even if that resident had a prior blood reported within 2 weeks in the previous calendar month. So basically, you are reporting the first positive specimen for that resident for that calendar month, regardless of what it is, okay? If it is a blood specimen, and it is not the first specimen for the calendar month. So let's say Mr. Jones had a positive MRSA wound on June 1st, and then on June 5th, he had a positive MRSA blood. That blood is considered a unique specimen source if he has not had a prior positive blood with MRSA in the previous 14 days. You guys following? I know this is a lot, but I have a figure. Don't worry, the figure is going to help. And I have some examples. So here's the figure. Are any of you participating in MDRO surveillance by show of hands? So we have some people. Once you start participating, you'll get the hang of it. But I'm going to read the figure to you again. I apologize, but I think that this will help. So Mr. Jones, you're looking for the first positive for the month, regardless of what it is, and you report it. If it's a positive urine for MRSA, then you don't report any other positive MRSAs from Mr. Jones during that calendar month unless he has a positive blood. Does that make sense? And if he does have a positive blood, you only report that if he hasn't had a previous positive blood in the past 14 days. We get that? Raise your hand if you're still confused. Oh, okay. Well, good. We'll move on then. I have some examples that'll help too. Specimens that should not be reported to NHSN as LabID events, of course, are your negative MDROs. Specimens collected during an inpatient admission in another healthcare facility, so those are the same as for C. difficile. And then you don't report any duplicate positive specimens, which we just talked about. If a blood specimen is entered as your first positive specimen for that resident for that month, then you're off the hook. You do not have to report any more like organisms for that resident for that month, unless it's another positive blood that occurs after the 14-day mark. Let's do an example. On December 27th, Mr. C had a positive MRSA blood culture that was entered into NHSN as a MRSA LabID event. On January 2nd, he had another positive MRSA blood culture that was entered into the NHSN because it was the first positive MRSA isolate for the new calendar month. He had a wound that also tested positive for MRSA on January 20th. The specimen was not entered into the NHSN since it represented a duplicate MDRO lab isolate for the January. Again, on January 27th, Mr. C had another positive MRSA blood culture, and since this isolate represented a unique blood source, meaning it was more than 14 days since his last positive MRSA blood specimen, this MRSA blood specimen was submitted to the NHSN as an MRSA LabID event. That good? Okay. Just in case you still need some more examples, let's assume that Mr. Smith, that this is his line listing. This is not, this is a verbal response. The clickers do not work with this. His current admission date is February 1st for the entire line list. Let's look at row 1. The specimen collection date is February 2nd, 2018. It is a positive urine, and the lab result is an MRSA. Do we report this as a LabID event? Yes. Because this is the first MRSA from any specimen during the calendar month for this resident. On February 17th, he has a MRSA positive wound culture. Do we report this as a LabID event? No, because this is a non-blood source, and he's already had his MRSA positive isolate for the calendar month. Moving forward, on February 21st, he has a positive blood MRSA. Do we report this? Yes, good. Because this is defined as a unique blood source since he had not had a prior positive MRSA blood in the past 14 days. Again, on February 26th, he has another positive MRSA blood. Do we report this? Good. No, because it is a duplicate. On the 28th, he has a positive MRSA nasal screen. Do we report this? No, because this is a screening test result. And even if it was another specimen source, you still would not report it because he's already had his non-blood MRSA reported for the month. Moving forward, on March 1st, he has a positive blood again for MRSA. Do we report this? Good. I hear somebody. So it is the first positive in the month. Even though he had a positive blood within the previous 14 days, this is the first positive MRSA for that month. So it still gets reported. Now, if it was reversed and he had a urine first and the blood second, then you would not report the blood, right? Because it would be considered a duplicate. But since this is the first positive blood for that month, we do report it. And then on March 11th, he has a urine positive for MRSA. Do we report this? No. So once you report that blood for the month, then no other non-bloods are reportable for the remainder of that month for that organism. And then on March 14th, he had a urine positive for VRE. Are we going to report this? Yes, because it's the first VRE and it's a new organism. Similar to the CDI Lab ID event reporting, NHSN does analyze your MDRO Lab ID event submitted to the application. NHSN will categorize the MDRO Lab ID event as community onset or long-term care facility onset, and all of your long-term care facility onsets will be further categorized based on a recent transfer from an acute care facility. These definitions are the same for categorizing CDI as well as MDRO, so you're working with the same set of definitions here. A community onset will be any specimen collected 3 calendar days or less after the current admission to the facility. The long-term care facility onset are any specimen collected more than 3 days after that current admission to the facility. And then long-term care facility onset cases are further categorized as act low if the resident has spent time as an inpatient in acute care facility in the previous 4 weeks and was directly admitted to your long-term care facility. Again, the same illustration here. So next I want to talk about entering the data into NHSN or submitting your CDI or MDRO data. We talked earlier about the monthly reporting plan. The monthly reporting plan must be completed. Each month the facility wants to participate in NHSN reporting. Again, the Lab ID event surveillance must occur for the entire calendar month and for all specimen sources. When participating, you will submit all non-duplicate Lab ID events to the NHSN application, and then you will also complete your summary data at the end of the month. And then lastly, you'll want to make sure that you resolve all of your outstanding alerts so that all of your data is included in analysis. To begin entering data, we would use our grid card and go to the SAMS.cdc.gov website. I'm sure most of you are familiar with this, and you're going to log in using that grid card and your credentials. Here we go. You're going to select NHSN reporting. And then you will select your facility from the drop-down box. In most cases, you're going to just have one facility in the drop-down box unless you work for multiple facilities. And then you will select your component, which will be the long-term care facility component, and click Submit. And then once you do that, you're ready to go. So again, we talked about the monthly reporting plan already. That is just really an agreement that lets NHSN know what your facility is planning on submitting for the month, what data that we can expect you to submit for the month. You will have to make sure that you have a monthly reporting plan set up before you begin reporting. If you attempt to report an event prior to having a monthly reporting plan set up, you will receive an error message. So always be sure to have that monthly reporting plan set up. This is a screenshot of what your monthly reporting plan will look like if you're only reporting in the Lab ID event module. So you can see here, it is the second bucket I call the Lab ID event module. You will choose the location, which will always be FactWide in, and this will auto-populate for you. So I say you will choose, but really NHSN chooses for you. The specific organism type, select the specific organism. So in this case, we're going to select C. difficile and MRSA. If you want to add additional organisms from the protocol, for example, you want to add VRE, then you simply would click Add Row and an additional row will populate and allow you to select an additional organism. And you can keep doing this add row until you've entered all of the organisms that you want to submit data for the month. And this is, you'll also notice that there's a copy from previous month. If your facility is performing surveillance for several specific organism types, then this copy from previous month really does come in handy because you won't have to individually select each row. You can just click copy from previous month and it will pre-populate your next month's reporting plan for you. So for the LabID event module, this is the only section we will complete, and then once that is done, just click Save at the bottom. We have a knowledge check. Okay. Let me open the polling. I apologize, I'm having a delay up here. Oh, there we go. Based on the reporting plan below, what modules and events will this facility report for June 2018? A, UTI only. B, UTI, CDI, and MRSA LabID events and prevention process measures for hand hygiene and gown and glove use. C, CDI LabID event only. Or D, all LabID events. Very good. C, CDI LabID event only. Next, I'm going to walk you through submitting a non-duplicate LabID event. How many of you have been entering LabID events already into the application? How many of you have not ever entered a LabID event into the application? Okay. I mentioned earlier that we have a form for everything that you could possibly want a form for, and it's no different for LabID event reporting. There is a LabID event form that can be used with CDI as well as any of the MDROs. You would use one form per event that you're reporting. Again, these forms can be customized if you would like to add additional data elements on the form that your facility may be interested in documenting. And we do have table of instructions for the form that will give you specific details of how to complete every single section of this form. When you're ready to submit the data to NHSN, you will log on, like we talked about, on the left-hand side of the screen, your navigation bar here, you'll select Event and then Add. Once you do that, you're going to first come to your resident information. Everything with a red asterisk is required. So you can see here your facility ID will auto-populate for you. You will need to enter that resident ID for the resident, and that is the medical record number or however you identify that resident in your facility. And then gender and date of birth are the only other required data elements. Next, you will need to select if the resident is a short stay or a long stay resident. And NHSN defines short stay as a resident that on the date of the specimen collection, so your event date, the resident has been in your facility for 100 days or less from that date of first admission. So the most recent admission to your facility, has it been 100 days or less? If it has been more than 100 days, then that resident is defined by NHSN as a long stay resident. The date of first admission for that resident defined by NHSN is the date the resident first entered into your facility. And this date will remain the same unless that resident leaves your facility for more than 30 consecutive days. Otherwise, you don't change that date. The date of current admission to the facility, this date is really important because this date is used to determine the categorization of your LabID events, right? And this is the most recent date that resident was admitted to your facility. If the resident was first admitted to your facility and has never left your facility for more than 2 calendar days, then your date of current admission will stay the same as your date of first admission. But if that resident is transferred out of your facility for more than 2 calendar days and then returns, that date of current admission will change to the date the resident returns back to your facility. Let's do an example. A resident in your facility since February the 1st, 2016, is transferred from your facility to an acute care facility on June 2nd, 2017, and returns on June 10th, 2017. The current admission date would be June 10th, 2017, since he was away from your facility for greater than 2 calendar days. The date of first admission does remain the same as February 1st, 2016, since that resident did not leave the long-term care facility for greater than 30 consecutive days. A week later, that same resident goes to the emergency department for evaluation on June 15th and returns on June 16th. The date of current admission does stay the same as June 10th, since he was not away from the long-term care facility for more than 2 calendar days. Once you enter the resident information, you're going to scroll down to the event section. And here, the first thing you want to do is you want to enter your event type. For reporting C. difficile or an MDRO, we're going to select LabID Event as our event type. And this would be the same regardless if you were reporting a C. difficile or an MDRO. And then you're going to select the date that the specimen was collected. This is also referred to as the event date. I do want to point out that your date of current admission cannot occur after the date of that specimen collection. So meaning that the event date must occur after the current admission date. Next, you're going to select the specific organism type that you're submitting data for. After selecting this organism type, the remainder of the fields will populate based on the organism type that you select. So let's say that we're going to select C. difficile as our organism type, and then you're going to have the body site and the specimen source will auto-populate for you, since C. difficile is surveillance for NHSN is only looking at digestive system and stool specimens. That auto-populates. Next, you want to select the resident care location, and this is the location in your facility where the resident was residing when that specimen was collected. And this is why it's important to set up your resident care locations right after you complete your enrollment with NHSN. If you have not already mapped your resident care locations, this box would be blank and you would not be able to complete this event. So this is an example of why it's really important to get those resident care locations mapped before you begin reporting in NHSN. So here you select the correct resident care location. If the resident had a specimen collected from an outpatient setting, so let's say the resident went to the emergency department, your resident care location will be the resident location where the resident was residing prior to that brief outpatient visit. Next, you're going to select your primary service type for that resident. And then the question, has the resident been transferred from an acute care facility in the past 4 weeks? And this means, has the resident been transferred into your facility directly from an acute care facility in the past 4 weeks? And if your response is yes, then an additional question is going to ask you the date of the last transfer, and as well as, was the resident on antibiotic therapy for this organism at the time of transfer? So in other words, for C. difficile, was the resident receiving treatment for C. difficile at the time he or she was transferred from that acute care facility into your facility? So this is we're starting to get into burden coming into your facility, okay? If the resident has received care in an outpatient setting, the emergency department, that is not considered a transfer from an inpatient setting, so that would not constitute a yes on here. If that is the only transfer, then the answer would be no. So this is only asking for transfers from inpatient status into your facility. It does exclude outpatient visits. Okay. Here, if you answer yes, the resident was transferred to my facility in the past 4 weeks, and yes, the resident was on antibiotic therapy for this specific organism at the time of transfer, keep in mind that there is a denominator question that asks about the number of admissions to your facility on C. difficile treatment. So you will include this resident in that overall aggregate count, okay? Keep that in mind. It's going to make more sense when we get to the summary data section. We often get asked, how am I supposed to know if the resident is on C. difficile treatment? So here are 3 of the most common antibiotics that are used to treat C. difficile. I find it ironic that the standard treatment for C. difficile is another antibiotic, but wanted to share these with you so that you will have them. So you want to keep these in your back pocket, and this is what you're looking for if you have an admission from an acute care facility. So you're looking for oral vancomycin, usually, Flagyl, or phytomoxine. Did I pronounce that correct, my ID physicians? Yep, that's good. So that's what you're looking for. Okay. And then the last question on here, it says documented evidence of previous infection or colonization with a specific organism. You can ignore that. It's grayed out in the application, and I don't even think it's included on the form because this is something that our analysts look at behind the scenes, and it auto-populates behind the scenes. So you can ignore this question. It's not even pertinent to C. difficile. It's really pertinent to MDROs. But it is non-editable. You cannot edit this. Even if you don't agree with what it says, yes or no, you cannot edit this. We do have custom fields. Has anyone in here ever used the custom fields? So custom fields allows a facility to easily document different variables of interest. So for example, if you're looking at C. difficile, or let's say that you have a C. difficile project going on in your facility and you wanted to look at all residents who have been on fluoroquinolones or cephalosporins to determine if they have a C. difficile Lab ID event. You can set up custom fields to actually ask those questions in the application so that when you enter an event or anyone enters an event, you would answer those additional questions. This is not something that we're going to get into a lot of detail this week because it is more advanced analysis. But when you get there and you're interested, then please let us know and we can help you to set up custom fields. We have had facilities set up custom fields for UTI surveillance and for C. difficile surveillance, and they have phenomenal documentation they use for some of their efforts and outreach in their facilities. So when you get there, let us know, and we'll be happy to help you set those up. But they're there. NHSN does not do analysis of your custom fields. It is strictly an internal analysis option for our facilities. And then you have a comment section, which is for your free text. Again, for your internal documentation, it is not analyzed at all. This is what a complete C. difficile Lab ID event will look like in NHSN. If you can see that, I'm not sure how small that is, but once you click save, you will see the event number populate, and that lets you know that you have successfully entered a CDI Lab ID event. You do not have to write down the event number. If you want to, you can. That there are search features within NHSN where you can search by event number, but you can also easily search by month or location, so you don't have to write that down. Next, I'm going to run through submitting an MRSA Lab ID event. This is pretty much the same, so I'm going to kind of fly through the duplicate stuff and just highlight the things that are a little bit different, okay? So you would do event and add, enter your resident information. Again, your resident type for short stay versus long stay is the same. A short stay is any resident who has been in your facility for 100 days or less, and a long stay would be any resident who has been in your facility for more than 100 days from that date of first admission. So again, you're looking at the event date and the date of first admission to determine short stay versus long stay. Date of first admission, we talked about, that's the very first time that resident entered your facility and has not left your facility for more than 30 consecutive days. And the date of current admission to your facility is the very last date that the resident was admitted to your facility. Scrolling down to event information for MRSA or any of the MDROs, again, your event type is going to be a Lab ID event type. The date specimen collection is going to correlate as the event date. And remember that the date the specimen is collected cannot occur before that date of current admission, because only specimens collected during an admission to your facility are reportable by your facility. Specific organism type, when you click on that, you get all of your options. So if you're going to select a MRSA Lab ID event, you would select MRSA. The specimen body, site, or system you choose. So for example, if we're going to select a positive urine culture with MRSA, we would select GU for genitourinary system. And then our specimen source. In this case, a urine culture would be a urinary specimen. Our resident care location, and this is going to be the location of the resident at the time that specimen was collected, also referred to as the event date. The NHSN primary service type for that resident in that location. Has a resident been transferred from an acute care facility to your facility in the previous 4 weeks? Same question. If you select yes, you're going to have the same questions populate at the bottom, the date of last transfer, and if that resident was receiving antibiotic therapy at the time of transfer to your facility. And again, this is going to allow you, if you were interested in running analysis reports, looking at your positive MRSA or other MDRO Lab ID events, and assessing how many or what percentage of those residents came directly from an acute care facility and were on treatment for that specific organism. Okay, we just talked about this. And the last question, the documented evidence of previous infection. This is auto-populated by NHSN, so you can ignore that question. And then we have the same options for custom fields and comments. Once you click Save, you'll again get an event number to let you know that your event was saved successfully. So next, I want to talk about your monthly summary data specifically for Lab ID event reporting. We have this form, again, that I've talked about, and the accompanying table of instructions. And then we have this worksheet. And remember, on the worksheet, you only have to complete the columns specific to your surveillance plan. For C. difficile and MRSA or MDRO, that means we would complete the number of residents, we would complete the number of admissions, and then the number of admissions on CDI treatment. We would not need to complete the middle two columns if we're not performing UTI surveillance for the month. And so this worksheet allows you to document daily and only enter your total number into NHSN for that calendar month. To get to your summary data, on your left navigation bar, you'll click Summary Data and click Add, then select your month and year. Your monthly summary data page will populate based on your monthly reporting plan for that month. This is March 2018. This monthly summary data is populating based on what we submitted to NHSN in our monthly reporting plan for March 2018. You can see here, we elected not to perform UTI surveillance for the month in our monthly reporting plan. We only elected to do MDRO and CDI LabID event. And you can see here, looking at this row, the LabID event, we have selected to perform and submit surveillance data for MRSA and for C. difficile. So this is pre-populated, and everything with a red asterisk must be answered in order to complete our monthly summary data page. Let's check your knowledge. Our web streamers, this is your opportunity to participate on responseware.com. I'm going to open the polling. There we go. Based on the monthly summary data below, what modules and events did the facility select to participate for March 2018? A, all modules, all events. B, MRSA and CDI LabID events. C, CDI and all MDRO LabID events. D, no modules or events. Very good. You can see here we are performing surveillance for MRSA and for C. difficile, and that is it. Good job. And I talked about everything with a red asterisk must be completed. And for LabID event reporting, that includes your resident admissions, your resident days, number of admissions on C. diff treatment, and also you need to select report no events. If your facility did participate in surveillance for these organisms and did not have any events reported, meaning there were none identified. If your monthly reporting plan indicates that you are following or conducting surveillance, in this case for MRSA and C. difficile, but there are no events reported in the application, this row right here beside report no events will have 2 red asterisks next to each box. And what that again means is that your monthly reporting plan says that you are participating in surveillance for these organisms, but the application could not identify any events for this particular calendar month. So what you have to do is put a check mark in the boxes to confirm that yes, you did perform surveillance, but you did not find any MRSA or C. difficile LabID events to report. If you select these boxes, and let's say 2 weeks after you complete your summary data, you find a positive MRSA blood, and you're like, oh, what do I do with this? I've already told the application I didn't have any for the month. That's okay. Go back and enter that MRSA blood as the LabID event, and the application will auto-populate itself and adjust your summary data for you. You do not have to edit your summary data, but you do need to enter that event and let the application auto-adjust your summary data. So we want you to enter those events even if you've closed out the month. It's really important that you're getting those events in there so you can have an accurate representation of the data and the burden in your facility. And I want to go over some of these specific variables because we do get some questions. So for example, resident admissions. Again, this is only required if you are performing monthly surveillance for LabID event. Resident admissions is not required for UTI surveillance. The NHSN defines resident admissions as the total number of residents admitted to your long-term care facility for that selected calendar month. This includes new admissions as well as readmissions to your facility if that resident was out of your facility for more than 2 calendar days. Resident days is for each day of the month, you need to record the total number of residents in your facility, and then at the end of the month, add those daily counts and then enter those as your total resident days. We do have facilities that have electronic medical records available, which is great. If you have an electronic medical record or another electronic means to calculate your resident days, you are welcome to use those. We also have some users who opt to estimate their resident days. And if you wanted to estimate your resident days, you could take your bed size and then your occupancy and multiply those times the month. So for example, let's say that you're 100 bed facility and for the month of June, you were at 100% occupancy. What you would do is you would take 100 residents, if you're at 100%, multiply that by the number of days in the month. So for June, we have 30 days in the month, and that gives you 3,000 total resident days for the month of June, and you could enter that as your resident days. If you are at 90% occupancy for June, you can estimate, do 90% times your bed size, so 90 times 100. So that gives you 90 residents estimated for the month times the number of days in the month, and that gives us an estimated 2,700 resident days for the month of June. So you have options available to you for those resident days. Number of admissions on C. difficile treatment. This is an important variable that allows you to analyze the C. difficile infection risk coming into your facility. You will have access to NHSN analysis reports like what I have on the screen here, and that allows you to look at treatment prevalence on admission. Again, this data, this variable is only required if you're participating in C. difficile LabID event reporting for that month. It is the total number of residents who were receiving antibiotic treatment for C. difficile at the time of admission to your facility, and this includes new admissions and readmissions. It does not include residents going back and forth from the emergency department, only new admissions and readmissions. It does include all residents admitted on treatment, including those who do not meet the NHSN criteria for a CDI LabID event. What that means is when you're looking at this variable, when you're looking at your admissions on C. diff treatment, it doesn't matter if the resident meets NHSN criteria for CDI. That's not what you're looking for. Your only concern is if that resident comes into your facility on treatment, because again, you're looking at the burden of people coming into your facility who are receiving treatment for C. difficile. And then the last thing that you'll need to do on here, which we've already talked about, is address the report no events. If this box is grayed out and there are no red asterisk, that means that you did enter events for that calendar month, and you can just skip right past that. Okay, I've already talked about this. So now I've just confirmed that, yes, I did my due diligence. I performed surveillance from MRSA and C. difficile for the month, and our facility is so good that we had 0 events to report. So I put my check marks in the box, And once you click Save, you should see the message that says your summary data was created successfully, and that lets you know that you have successfully entered your monthly summary data. The last thing I want to spend some time on is the data quality. We talked about data quality in the first session, but I want to spend some time on how data quality is influenced by LabID event reporting specifically. Alerts are automatic checks within the NHSN application that remind users of incomplete or missing event data. Your data, again, are not considered complete and will be excluded from any analysis, and that includes any analysis that you run internally for your administrators until the alerts are resolved. This means that before doing any analysis functions yourself, you need to make sure all of these alerts are addressed. To address your alerts, you can click on the left side of the field, but the easiest thing to do is look on your home page, and you can see here I have 47 missing summaries, 4 incomplete summaries, 4 incomplete. Does this look familiar to anyone? So I would need to address each of these boxes individually by just clicking on the number, which is a hyperlink. And when you click on the number, it's going to populate into the line listing at the bottom. I want to go over the common alerts that you will see for LabID event reporting. Missing events is a very common alert that we hear about. And what this means is that you selected LabID event modules in your monthly reporting plan, but you did not report any LabID events, and you forgot to click that Report No Events box on your summary data. Remember, I showed you the summary data, and you have to click Report No Events. We've made it easy for you on this particular alert. So for 5/2017, for our LabID event MRSA, I can look back on my documentation, and if I know that we conducted surveillance and we did not identify any MRSAs for that month, all I have to do is just put a check mark here to Report No Events, and then save, and that resolves that alert. If I know that for that month that, that's the month that we decided that we were not going to perform NHSN surveillance, what do I need to do? Go back to that monthly reporting plan and put a check mark in that box to indicate we decided that we're not following surveillance for this month. We're not performing or submitting. But I would also need to delete that summary data. So if you don't perform surveillance for a month and you're not going to enter any events, then remember, do not enter a summary data page. So you would just enter nothing. Just be sure to save if you do click Report No Events here, be sure to save, and that will resolve that line item. Missing summary data is another alert that we see sometimes, and what this means is that your monthly reporting plan includes LabID event reporting, and maybe you did or did not report events, but you did not complete your denominator reporting for the month. And here, once you click on that number, it brings you to your line listing of outstanding alerts, and you would click on the hyperlink Add Summary Data. And when you do that, it brings you to your summary data page, and just complete everything with a red asterisk and save, and that will resolve that alert. You will need to follow those steps for each line item that is outstanding. Incomplete summary data. This again happens when your summary data is not complete and you are missing. A lot of times you're just missing that one Report No Events, or you could be missing another variable. Here are our resources, and I will take questions now, and then you guys will be ready to get ready for your lab session, and I'll give you some guidance on your lab session as well. And then Courtney, you may have some updates, or I can give the updates. What questions do we have? If you have a question, if you would come to the mic so our web streamers can hear you.
Can you give some examples of how the custom fields can be used specifically for UTIs?
Yes, so UTIs, we have facilities that want to look at UTIs that are treated with certain antibiotics. We have facilities that have incorporated antibiotic stewardship into their UTI reporting, and with that, they've set up certain custom fields such as certain antibiotics that are being used. They also have a custom field for other resident level variables. Like I think they had one was the resident diabetic, was the resident immunocompromised. So it would be specific to something that your facility was interested in. But for example, if you wanted to somehow incorporate it into antibiotic stewardship, you could definitely do that. And if you're really interested in more information, then if you would send me an email, I can put you in contact with the facility that did the project. It was successful, and it was a corporate system. And they brought all of their individual long-term care facilities on board under this corporate chain, and they all participated in this antibiotic stewardship activity, and they had good results. And they incorporated the custom fields into that, and they did their analysis of the custom fields. And welcome.
Angela, I have some questions.
And then if you're going to the lab session, that is something that Elizabeth Mungai's session, so that's session A. So session A is where you would be able to ask that question. Elizabeth can maybe show you some of that as well. Okay, we have some questions from our streamers.
Yes. Do we still report CDI lab events that occur when the resident was already diagnosed with and treatment for CDI but has not shown resolution of illness?
If the facility tests the resident for CDI and it is positive and it's considered a non-duplicate, meaning that resident hasn't had a prior positive tested in that facility in the past 14 days, then yes. If you test it, you report it.
Okay. If a long-term care patient was seen in the emergency department and had a C. diff collected in the emergency department, you want me to report it in the long-term care? The patient safety training wants me to report it in the emergency department as it was collected there. So I would be reporting it twice, once in the LTC module and once in the ED module. Won't this make it look like we have more C. diff than we really do?
No, yes, you will report it in both areas. And the reason we have it set up this way is because there's a disconnect right now between surveillance systems and what's going on in the community and what's going on in the acute care facility versus what's going on in the long-term care facility. So until we're able to connect these facilities by surveillance systems or EMRs, then that is the way that we've come up with to track what's going on with that resident in different locations. For your long-term care facility, you may or may not know what's going on with your resident when he or she is in that acute care facility. So yes, they report for the ED because they're looking at community cases because they may or may not know that the resident is a nursing home resident or a skilled nursing resident. So the answer is yes, you would need to report it in both places.
Are there any more questions?
So the next, so you guys you're going to have some extra time, which is good. If you are going to the data analysis hands-on sessions, I recommend that you get there early and get your computer set up, especially if you're going to session A. That session holds 60 people, but you will have to have your own laptop. And so you'll need to go in, get your laptop set up. Elizabeth will have papers for you to get you signed in because it is a hands-on session. And with that session, you're going to be going through analysis, and she's going to take you through how to run reports and just some high-level analysis and helping you to apply some of the data that you're reporting in your event reporting to what you can expect to see in the outputs or the analysis reports. She's also going to review some of the most common analysis report options you have. If you're going to session B, that is in our computer lab. We have computers already set up for you, and that session is really for the novice user who needs help with navigating NHSN. So that's going to be a hands-on. You're really focusing on that left navigation bar that I've been talking about and what your options are when you click on facility. What can you do under facility? What can you do under each of those sections? So that's the difference between the two labs. But I do recommend that you go get your spot and get set up, because they will be starting promptly at 3:45, because there's a lot of information to cover. And do I have other announcements you want me to make?
I can make it.
Okay.
I do want to add, there have been some questions in regards to not having your SAMS card with you. You do not need any of those credentials. We will be using a demo site, so we will have, you'll have your own username and password. So once you get set up, we will give you that information. So you do not need your credentials with you to still participate. Thank you.
We have a question. Oh, wait. And while Courtney is running back there, I do want to say the web streamers, this is the end of your day. The lab sessions are not live. They're hands-on lab sessions, and they will not be web streamed.